Ooh. Hey guys, Dr. Eric Smith. Today I have Rebecca. Rebecca is an awesome personal trainer down here in Chicago, and she works in the surrounding areas in the burbs and such. So if you're looking for a great trainer, check out Rebecca. You'll see her Instagram. We'll tag that below. You can contact her. And what she's coming in for today is a little bit of low back pain. So I'm going to let her describe what she's got going on and how it affects everything in her life.
So I was having tailbone pain, and that is associated with your SI joint when I was doing squats and any type of hinging movement. It was a lot of pressure and like a pulling, and then it was kind of, I think, also causing my right hip flexor to be really tight. And then I came to Eric to try and help with that.
Yeah, so we were doing pretty good. She's still training hard, and then with some life changes, not being able to work out as heavy, it's been a little bit of an exacerbation. So today we're going to treat that. So we're going to show you how we stretch and get ready for that type of adjustment, adjust it, and then I'm actually going to do some muscle release on what's called your psoas. So your psoas is one of your hip flexor muscles that brings your leg up and over, and it's tied down a lot of people. So we're going to get into that. So I'm going to have you go ahead and lay face down for me, please. So feet are off a little bit. Rebecca's pretty flexible, so not too much in the restrictions and her quads being tight. When we look at her pelvis, her right side's up quite a bit, and she's just shifted over. So a lot of the pain that she was associating was in her SI joint. So you have your spine, and then you have your sacroiliac joints, which are right through here. And when you move and walk, they should go in this circle and kind of in the back. So more like an elliptical pattern, not just straightforward and side to side, but an elliptical pattern. So a lot of times people will get jammed up in certain positions. And this is where larger things like stepping up on a box, or I do it when I stand up on a spin cycle to get your sacroiliac joints moving with kind of larger hip movement, helps out quite a bit. So your erector muscles are pretty tight down here. How's your neck been?
It's been good. Yeah.
Okay, so we're going to start out by doing a little bit of flexion-distraction. So this is a technique that we use in the office here. This helps out quite a bit with just stretching out some of the musculature back there and ligaments, as well as just kind of hydrating the discs. So this is usually something that feels pretty good for most people. One of the common things that people come in and say is, I just wish somebody could just stretch my back and pull it apart. So this is one of the techniques that does this by this front to back motion, which we call flexion and extension, and then also a little side to side motion. So it's a little bit hard for you to do this on your own. When she's laying here like this, she's just passively letting her muscles relax so I can get some more movement out of her joints. Usually people come in with sacroiliac dysfunction. That's something that a lot of people will find when they Google or look for different things to see what's going on. With her in particular, I feel like she has not only some sacroiliac dysfunction, she's got a lot of pressure on the lowest part of her vertebrae here. So that just lights up her facets a little bit. So facets are kind of the joints that stack on top of the back, and they stop us from totally folding backwards. And then we do not have facets on the front of our spine, so that's why we can bend forward. So the facets also limit our ability to rotate through there, but they do allow some lateral bending. So we're going to get to the adjustment portion here. A little restricted through here. Nice deep breath for me. All the way out. Ooh. All right, so you're shifted up like that. Let's have you lay on your right side first and face me. So with you, you're pretty flexible. So I'm going to bring you all the way to the edge here and just relax this back. Good, awesome. Let's go to the other side.
That was a good one.
Your favorite part, right? Yep. Awesome. Go ahead and lay on your back. So even though her main complaint is her low back, I'm more of a full spine adjuster. If you watch any of our videos, you'll see that too. The main goal of what we're doing in our approach is affecting your neurological system, so your brain talks through your body, through your spinal cord, and if anything's messed up here, it can kind of influence the rest of the body as well. So in terms of helping her to recover and making sure that she's seeing all the results that she wants from her hard workouts, feeling well, and keeping her immune system working well, adjustments can help that out. Awesome. And then let's get this here. Turn your head all the way to the right. Good. A little hug. Okay. So we did some of the fun part. The adjustment. How did that feel?
Really good.
Good. So now this is something that I suggest for a lot of people when they have a lot of tightness in here, especially if their pelvis is doing this type of position. If you've been sitting a lot at home, different work ergonomics. By working at home, this can be a problem. So we're going to work on under a hip flexor. So the motion I'm going to have her do is we're going to bring her leg up, and then I'm going to pin the muscle down through there, and then she's going to kick straight out and go to the side. So the way that we're going to do that is I'm going to have her scoot a little bit closer to me on this side. So I'm going to block here at your hip. So you'll bring this all the way back and then down, and you'll turn your leg out and try to let that drop, okay? So we're going to do 4 tight passes, and you're not going to fall off. You'd have to take me out, okay? You ready? So hold that there for a second. So I'm going to get in here. Not the most comfortable thing. Go ahead and push. Good. All the way out and down. Good. Come on back up. Get a little bit closer. Good. How's that feel?
I felt that one.
Okay, kick all the way out. So before we do the last one, to get you to think of something, if you do this motion at home from the side of the bed and you feel a snap or a pop in your hip and it can keep happening, then that's actually the muscle is snapping over. It's called snapping hip or snapping hip syndrome. So take a look at that. It's really just the tight muscles. So we're going to do one more pass here, getting in really kind of tight. And go ahead and push. And all the way out. Cool. All right, let's have you sit up. Swing your legs around that way. Okay, try to move your head in a big circle. How's that feel? Any other areas a little tight?
Nope, that's pretty good.
Okay, and then why don't you go ahead and stand up, try to bend over, touch your toes, see if you feel a little better.
Yeah, that feels good.
So one of the things that she told me too is she felt like a little bit weaker. So if your body is off at the base, things are going to be off at the top. So if you feel like you have any of those symptoms going on, or just the pain in the hip, make sure you get to your local chiropractor. And if you have any questions, just comment below. Thanks for coming in, Rebecca.
Thank you.
See you next time. Thanks, guys.
Bye.